is that the facility is a participating facility with Medicare. Because if it's not, you have a different responsibility to pay. So as long as the skilled nursing facility, and most are participating with Medicare, there's essentially full coverage. Yes.
I hope you're not complicating this, but what if you have long-term care insurance? How does that?
Yeah, that would definitely complicate it. There is the question is, what if you have long-term care insurance? So don't confuse skilled nursing facilities with nursing care facilities. Those are two separate and distinct things. Okay? Yes, ma'am. Most skilled nursing admissions most skilled nursing admissions do follow a hospital admission. There are rehab centers. There are rehabilitation centers. Yes, and we'll go into that as well. Okay? So let's talk about, we talked about office visits, but under that category of office visits, under outpatient care, you'll see the different categories of care that fall under outpatient care. So accident treatment, radiation therapy, lab and x-rays. We all have lab and x-ray exams that we take. Podiatrist visits, durable medical equipment, cardiac rehab services, full coverage. Okay? Blood glucose monitors and materials for testing sugar levels, full coverage. Urine test strips, full coverage. Chiropractic services, full coverage. Emergency room care and outpatient treatment for physical therapy, speech pathology, and occupational therapy, full coverage. So if you're going for physical therapy or occupational therapy, there's full coverage. The plan keeps you whole. So I want to recap that the MedX2 plan works nationwide. If any of you travel to Florida for a few months out of the year and you have doctors down in Florida, this plan will work down in Florida. It'll work down in Arizona. Yes, sir.
Will it work outside the United States?
So you're covered for emergency room care. So your network is in the continental U.S.
If you're in Europe, you're not covered by
For emergency room care.
Okay.
Yes. If you move permanently, this will travel with you. Yes. Yeah, so a question is, what happens if I'm traveling and I'm in Europe and I fall down and have to go to the emergency room? This provides emergency room coverage only. Okay. That sounds like an emergency to me. Yeah, no, that would be part of the emergency admission. You wouldn't be able to move to Spain and all of a sudden pick up a doctor